The U.S. Supreme Court ruling on the health care law is due on Thursday. Our next guest says repeal is the only solution. James Capretta was the White House's OMB Associate Director responsible for all health care in the first George W. Bush administration. He now is a visiting fellow at the American Enterprise Institute. Thanks for being with us, James. Let's just start with which do you think is more damaging to the economy, the spiraling upward health care costs we've been dealing with, or Obamacare?
Well, they're both terrible. You know, the health care law, though, won't solve the first problem. It'll make it worse, especially for employers. And so, you know, we had this problem of rising health costs. We were told that the health care law would fix it, but it's quite clear that it's going to exacerbate the problem over time, not solve it.
Okay.
It's got the government knee-deep involved in everything. It's going to drive premiums up, not down.
Okay, and what do you think is the most likely scenario for how the Supreme Court rules on Thursday? It looks like you have the most dire scenario that may come to light.
Well, I mean, who knows? I mean, the court will do what it's going to do. But let's assume they strike down the individual mandate and leave the rest in place. That will destabilize the law quite a bit. It'll be a very significant blow to the law, and I think it'll lead to more momentum toward repeal in the Congress, because what's left will be very unworkable. That'll become more and more apparent. The insurance industry will make that clear. And I think that'll lead to even more effort to repeal what's remaining.
Right, because if they say, hey, the individual mandate by which the government forces everyone to pay into this insurance fund, that's illegal and unconstitutional, but they leave in the new law saying, hey, pre-existing condition, you cannot be turned down so that I can get hit by a bus and then go buy insurance afterward, and yet I won't be contributing to that fund. That's why it'll be such a terrible outcome. But you actually like that idea because then it would force Congress actually to go forward and repeal? Could it even win the support of Democrats?
I wouldn't use the word like that idea. I'd prefer if the Supreme Court just invalidated the entire law and let the Congress work on a new program. But if they did leave that in place, I think it would be like what happened in many states. Washington State, Kentucky, Maine, several other states have tried to have those kinds of insurance reforms in place in a voluntary system. They haven't worked. They've led to an adverse selection, that is, lots of sick people signing up for insurance and healthy people not. The insurance industry has collapsed in those states. They had to repeal those laws.
Okay.
And I think that the very same thing could happen at the national level.
All right, just one last quick thing there. There's actually one idea you do like in Obamacare, and that's this individually controlled tax credits. Talk about that quickly. Well,
I mean, you know, there's many things in the law that were very, very bad, but of course, the basic concept of moving more people into individually controlled tax coverage so they can buy insurance on their own is basically a good idea. I think they substantially distorted that idea in the health care law. We should do that the right way in a replace program.
All right. Thank you so much for being with us, James Capretta.
Thank you.
Well.